So, ma'am, in the new age of facial aesthetics, we are seeing a lot of newer ages surgeries that people are opting for. Uh, like a lot of cases of eyebrow reconstruction surgeries, beard reconstruction surgeries, people are opting for a better mustache complete surgery. So, you being an expert in this domain for the last 10 years, it would be great if you can throw some light on the entire processes and how people go for it, and what are the very important vital points that every other person who goes for this should know.
Yes. So coming first to the eyebrow hair transplant, these days many people are looking for thicker eyebrows with a little different shape of eyebrow, and they are looking for fuller eyebrows for better aesthetic looks. So yes, that can be done. So that can be done in constitutional hypotrichosis. So somebody has no eyebrows or very less eyebrows by birth, or they have developed it in their childhood because of unknown reason, that is constitutional hypotrichosis. So yes, hair transplant can be done in those cases in the eyebrow. And then there are people who have thin eyebrows, they want to make it thicker. There also we are doing hair transplant. Then the third scenario is if somebody had a trauma, okay, or somebody had a skin disease leading to the loss of eyebrows. So we can do hair transplant in all these three scenarios, but one thing that patient should know, and which actually turns off a lot of people going for a cosmetic eyebrow hair transplant, is that the transplanted eyebrow hair, they tend to grow longer. The natural eyebrow hair, they don't grow long, but since we put scalp here, we selectively take thin single haired grafts from the scalp which is above the ear or behind the ear. We use exclusively those grafts to reconstruct the eyebrow. So if somebody has constitutional hypotrichosis, we require around 200 to 300 grafts for each eyebrow for the reconstruction. Those hair will be little thicker in caliber than the natural eyebrow hair, because that's the constitutional difference of the diameter or caliber of eyebrow hair versus the scalp hair. So these are the two things. But when it comes to expertise, the expertise is very important. The angle should be acute of the emerging hair, should be acute, and it should be almost zero. So we have to construct the head part, the body and the tail. So every eyebrow has three portions: head, body and tail. The direction of grafts is different in all the three parts. So to summarize, first of all, everyone should know that they will have eyebrow growing longer, so they will need to trim it once or twice a week to maintain the look. Secondly, their hair will look little thicker and denser than the normal eyebrow hair. So this was about eyebrow reconstruction. Now coming to beard reconstruction. There are multiple indications to do the beard reconstruction. These days, beard density and having thick long beard is emerging as a fashion. So people who have sparse beard, they want to have a denser beard, so they are going for a cosmetic enhancement of beard. Then some men have constitutional hypotrichosis in beard area, that is their eyebrow doesn't the beard doesn't grow at all. Okay. So in spite of having no hormonal imbalance, they don't have any beard. So that is the second scenario. Then the third scenario is in the sick population, when they tie their beard very tightly, they have a traction induced alopecia on one side of the beard. So the fourth scenario can be somebody is having trauma or skin disease leading to a patch of beard becoming bald. So now the important point in beard is the same, that since we are using the scalp hair, the caliber of the scalp hair would be lesser than the beard hair. Okay. So the natural beard is thicker, coarser and wiry, but the transplanted beard will be thin and straight. But if the patient keeps it trimmed, it doesn't stand out or it doesn't look good. So cosmetically it looks very good if somebody is doing a beard reconstruction. But one must understand the body has finite number of grafts. Okay, so if we are taking the grafts from here, then he is having a donor depletion here. So in future, if he develops baldness, he will have less hair for treating the baldness. Okay. So that point also should be told to each and every person if he is very seriously thinking to do a beard reconstruction for hypotrichosis. So that was the second thing. When we do a beard reconstruction of the upper part, the upper border of beard, so there we have to keep the same aesthetics in mind, that of the hairline. Okay, so we have to make it irregular. We have to use single haired grafts in that particular zone. The other areas we can still use doubles or triples, but singles are for the upper border of the beard. And if we are doing the complete beard reconstruction, we have to keep the central density maximum. In the submandibular, this region below the jawline, we can keep the density as lesser to make the look appear more natural. The third thing is the direction. So we have natural, if somebody has hypotrichosis, we will have some natural hair which will guide us towards the direction of the emergent hair. Some people have a rounded cowlick in this beard also. We can ignore that. We don't need to recreate that. The cowlick, the rounded portion in the beard area. So this was about beard reconstruction. We have done it in a lot of patients with good successful results. One more point that I like to add, if somebody is doing beard reconstruction for a patchy traction alopecia, post surgery when he has full hair, he should not tie them too tightly. Otherwise that patch will reappear, because the fundamental reason was the pull which was causing alopecia, and once that factor reappears, those transplanted hair are going to go.